Hi, good morning, Wakefield. Happy Friday. Welcome to our COVID check-in call. I wanted to start with a couple of housekeeping items for everybody before we get into some of the data. If you'd like to see Wakefield-specific data, you can go to our dashboard at wakefield.ma.us. There's a COVID tab in the main navigation, and you can see information that Anthony will cover. There's information from Doug at the school department, and there's also information from the state around vaccination rates and the positivity percentage of the abutting towns. So you can check that out at any time. One other thing to note is that next Friday is the beginning of a holiday weekend. So although Town Hall will be open, some of you may be heading out leaf peeping. So we're gonna not hold a call next Friday morning, and we'll resume again on the 15th. The last thing I want to say is if you did not join us last week, you may be seeing a familiar face here. Anthony Choi is our new health director. We're super excited to have him here, and he's going to review some of the data. I happened to peek into, as I was updating the dashboard, the last 30 days, so from the August 30th report till the one that was released last night. The folks in Wakefield that have received at least one dose is up 315 people, and the fully vaccinated is up 323. So our overall percentage for fully vaccinated has remained at 70%, but there is, we'll take every single one of those folks. We are up just over 300 in each category. So Anthony, would you like to go into the data a little bit more for us?
Sure. Thank you, Jen. So as you mentioned, I think it's great in terms of the folks getting the first shot. It's really going to help us moving forward in terms of going to the fall and hopefully to avoid more cases this season. In terms of the average daily cases, we've been seeing a slight decrease over the last couple of weeks. We are roughly at about three new cases per day. And so this is actually an improvement over the last few weeks. And this is, in relation to more folks getting the vaccine and following our protocols in terms of masks and social distancing. And so hopefully we'll be able to avoid last year's trends. Currently, we are looking at 71 confirmed cases right now in Wakefield, and we're hoping to work with everybody in terms of quarantine protocols. If there's any questions, you can always reach out to our health department and we'll be happy to assist. If we're looking at the vaccination rates for the different age groups, we are seeing an increase in the 12 to 15. We're up to 71% fully vaccinated right now. And so we're hoping to kind of reach out to individuals who are still a little bit on the fence in terms of getting vaccinated, that we can hope to kind of convince and show the data in terms of what they are contributing to here. And they're going to be helping us all stay safe during this fall. And as we look at the positivity rate here in Wakefield, we've also decreased as well. We're looking at about 3% positivity rate. And so with consistent testing rates, we're hoping to really catch as many cases as we can ahead of time so we avoid any community spread. One of the things I wanted to stress for this upcoming weekend, we actually have the flu clinic coming up. That's in conjunction with Festival by the Lake here in Wakefield. And so we want to make sure that folks are aware that the flu shot will be available there. And this season, more than any other one, it's going to be important for you to get your flu shot. Any kind of respiratory ailment going into the fall will really help avoid kind of a dual infection with COVID as well. So we want to make sure that folks are aware that there are places for them to get the flu shot. So that'll be this weekend on Saturday from 10 to 3 at Festival by the Lake. We also have another flu clinic. These are both 19 plus events. So they will also be run out of the Galvin Middle School. That one's on October 21st, and that will be a drive-through event. So hopefully you can join us here and get your flu shot with us. Another topic that we'd like to go over kind of briefly today are the discussions around a COVID-19 vaccine booster. And so that is specifically for the folks that got Pfizer in the beginning. So the Pfizer 2-dose vaccine has shown to have some waning immunity moving forward. And so the booster is now available in select pharmacies, and we can help you find those. If you have any questions, please reach out to us. We are currently working with the state to see if we can provide a clinic moving forward for the booster shots. And the evidence suggests that those in the 65 years and older category and those that are 18 and older who either live in long-term care settings with underlying medical conditions who work in high-risk settings. Those are the folks that are advised to seek out the third booster shot, and those folks will hope to see getting their booster shot after 6 months from their last shot. There's also news about the Pfizer shot for those being approved for 5 and older, so the age group from 5 to 11. And even though this has not been fully approved yet, we are expecting to see an approval process in November go through. So this is very important news in terms of helping us turn the tide against COVID, especially in the school age population. So we want to stress that we'll keep you up to date on this shot for the children between 5 to 11, but this is definitely our way out of the pandemic. This will help us really stem the tide of COVID and make sure that our schools are safe for our children. Thank you.
Great, so that's the perfect segue, I think, to Superintendent Lyons as he covers the Wakefield school system numbers.
Thank you, Jen. I appreciate it. And thank you, Anthony, as well. Our vaccination coverage continues to be strong, which we're excited about. And we want to promote and support all members of our community 12 and older that are able to get the vaccination. So if you're interested in getting the vaccination, or if you have questions about it, please do not hesitate to reach out to central office, to reach out to the Board of Health, and certainly our nurses can help with that as well. So it's been a busy week. We started symptomatic testing and test and stay on Monday. We've had a steady group of testing happening. Some of it started last Friday. We got a little bit ahead of the program a week ago today. And so students that were tested or that were close contacts in school were tested on Friday. When they came back on Monday, they continued to be tested. And so just a point of clarification about testing, the test and stay program is for 5 days, but it is it's really can be up to 7 due to the kind of the date of the exposure, right? And or the weekend. So often the students wouldn't be tested for less than 6 days if a weekend broke up that testing piece. But the good news is this past week that all students were tested, all tested negative. So that's the good news. And so we're continuing to kind of work on our protocols and improve that programming. Other news is that we're going to be working with the Board of Health on opening up facilities and facility rentals, and also welcoming back volunteers into the school in the month of October. So more information to come with that. The number of positive cases that we have this week in the Wakefield Public Schools are 19 total. We have 7 student cases at Galvin, 1 student case at Greenwood, 1 student case and 2 faculty cases at Walton, 5 cases total at the high school, 4 students, 1 faculty member. And we have 3 at Woodville. Those are positive cases. So it's 16 students and 3 staff members. The total number of positive cases over the last 3 weeks in the Wakefield Public Schools are 34 students and 8 staff members total. Quarantine, our total number of students in quarantine are 135 with 1 staff member. An interesting number, we kind of do, you've heard me say this on this call before, we kind of break out the reasons for quarantine. One of the biggest parts of the fraction of the 135 that we look at is what number of students or staff have been directed to quarantine by the Board of Health. Those are confirmed cases or confirmed close contacts that the Board of Health is helping us manage. In this particular case, of the 136 total quarantine cases this week, 91 were either symptomatic or a close contact outside of school. So meaning they had a sibling or a parent that was positive, which made them a close contact. So parents are keeping them out of school. Or they demonstrated symptoms and parents kept them out of school, students out of school as well, which is exactly what we're asking parents and families in the community to do. So that's really We're not happy that the number's so high, but we're particularly pleased and really genuinely appreciate the support and the decision-making on the part of families to keep students home. And so just one other piece of information is that the mask mandate will be continuing. The DESE, Jeff Riley, the Commissioner of the Department of Elementary and Secondary Ed, along with Mass DPH, extended the mask mandate until November 1st. There is a kind of a clause in the new guidance that states in the middle of the month, communities can assess where they are at their rates in terms of their rates of vaccination. If they are at 80%, local communities can make a decision as to whether they're going to lessen the mask requirements, but there'll be more information forthcoming from the school department on the school side in our meeting on October 12th. But we will also be working very closely with the Board of Health and Anthony on that. So thank you very much, Jen. That's all I have today.
Sure. And one thing that I think it's important to reiterate is that testing program is an opt-in program, not an opt-out program. So I know there's a lot of back-to-school paperwork. Some things get missed. If you do want to participate, have your child participate in that program, the website is www.cic-health.com/consent/MA. And I'm sure it's in some messages from the school and the principal. So just, it's not an opt-out program. You do have to sign up to participate. We have the chair and vice chair of our town council here. Councillor Butt, do you have anything that you would like to add on this Friday?
Thanks, Jen. And I'm giving my regards to Chair Smith Galvin, who had to hop off for 9:15 call. No, I just want to thank everyone. Doug, you and your team, and Anthony, you and your team, and Jen. I probably look at the dashboard like every other day. So I appreciate all that everyone's doing. And just a reminder, like always, to members of the public, please, get vaccinated if you haven't. Have those conversations with family and friends, like calm conversations, but about please getting vaccinated if they're 12 and older, and how it's just a public health imperative, and getting your flu shot this year. So I thank you to Anthony and others. I signed up for the drive-through flu clinic on the 21st. I'm really excited. I think that's my first drive-through flu clinic ever. And as I said last week or 2 weeks ago, my work's making the flu shot mandatory as the COVID shot also. And so thank you for my town for making it a little easier to comply with my work requirements. So just want to thank everyone for all that they're doing. And hopefully we will get on the other side of this soon.
Excellent. Well, thank you so much. And again, if you do want to sign up for the clinic that's happening on Saturday, if you're heading down to the Festival of Ida Lake, wakefield.ma.us/flu-2021. If you pre-register, it'll just save you some paperwork time when you're there. So if nobody else has anything to add, we'll thank you all. I hope you have a great weekend, and we'll see you on the 15th.